I'm a surgeon, and technically my patients are awake during surgery. I know that sounds crazy, but what it actually means might surprise you. Because when patients wake up afterwards, most of them say the same thing. That's it? It's already over? I don't remember a thing. I'm Dr. Karam. I'm a board-certified facial plastic surgeon, and today I'm breaking down exactly what happens in my operating room and why the way I put my patients under is one of the most important decisions I make for their safety and their recovery. So when I say my patients are awake, what does that actually look like? You're not talking, you're not sitting up, having conversations with me, you're not watching the clock, you're deeply relaxed, your eyes are closed, your body is completely still, you feel zero pain, you might mumble something, you might snore a little bit, which honestly, in my operating room, that's a beautiful sound. It means you're relaxed and you're breathing perfectly on your own. And here's the part that gets most people. Most patients can technically respond if I speak to them. Simple things like, let's adjust your position, turn your head side to side, whatever the situation is, they respond, which makes the surgery go a little bit more smoothly from my point of view. And then once the surgery is over, they wake up. And they remember essentially none of it, not because anything went wrong to make them have amnesia, but that's exactly how this type of sedation works. So let's discuss it a little bit. There are essentially two ways a surgeon can put you under, and it really has a lot to do with their preference as well as their level of comfort, etc. The first is general anesthesia, by far the most common type of anesthesia when you're having, facial rejuvenation procedures. What most people picture when they think of surgery, which is you're completely unconscious, your body stops breathing on its own, you have a machine that's breathing for you, there's a tube that's placed down your throat, and for something like open heart surgery, general anesthesia is necessary, right? I mean, it's very invasive. That makes complete sense. But when you're doing facial surgery, you don't need to shut down your entire system to get a beautiful result and to perform the surgery because it's relatively superficial what we're doing here. And then the second is what I use and I've been using for over 20 years, which is local anesthesia with IV sedation. Sometimes some people call this twilight sedation or conscious sedation. Here, your brain gets a deep, deep rest, but your body keeps doing its job. You breathe entirely on your own the whole time, no breathing tube, no machine. The difference is how you feel afterwards, but also the types of risks that you're exposed to between the two vary significantly. And I'm just gonna share this, and this is by no means meant to scare anyone and certainly not meant to advocate for what I do per se. I do what I do for the reasons I've chosen to do, and my patients love it this way. But I'll tell you, every once in a while, we get a story from somebody, a patient who underwent general anesthesia for a facelift, and literally woke up 3 months later, and she was in a coma for that period of time because she had some completely unexpected response to the induction of the general anesthesia. And I don't know all the details, but I know her brother was an anesthesiologist and literally for 7 years told her, you are not getting a facelift. You're not risking yourself for that again. And it wasn't until she found out, I don't know exactly how she found out, that I performed these things under local with IV sedation, that she got the courage to go forward with it, but also her brother gave full blessing for her to move forward. And I do this procedure a lot on physicians and a lot of them on anesthesiologists, and they actually prefer and choose to do it this way because it's possible. But again, at the end of the day, it's not meant to tilt you one way or the other. Again, it's totally dependent on what your surgeon feels comfortable doing. Again, this is how I do it, and I'm gonna explain a little bit more. So nobody warns you about the days after general anesthesia. And people who've gone through it realize that there's a fogginess, a grogginess, kind of like a hangover effect that can linger for a little bit. And when it comes to surgery, and not just facelift surgery, most people assume the rough part is over after surgery, the procedure itself, but a lot of people experience in the first stretch of recovery the nausea, the fog, the heavy groggy feeling that can follow for days. And that's not from the surgery, that's from the general anesthesia working its way out of the system. And the older we get, the harder that is for the body, the higher the risks of potential complication, blood clots and potential aspiration pneumonia, drug reactions, drug clearance, all these things. The longer these things can linger and the higher the risk can be on the cardiovascular system, in addition to other neurologic systems as well. But when we use IV sedation, we take that entirely off the table. The medications clear much faster. They're common medications that are used for this type of surgery are basically like Versed and fentanyl, which clear out of the body much faster. You're more lucid. You're not fighting through fog on top of everything else. Your body's already trying to manage, etc. Another beauty is the recovery starts on the same day. This is my favorite part to tell people, because you skip that post-anesthesia crash. Your body starts recovering almost immediately. When my wife had this done, she brought food to surgery. So the second we were done, she wanted to eat on the car ride home. Pairs actually, because she wanted to get the fiber in right away and some glucose into her and etc. She's a doctor and she knows a lot about this stuff. So she wanted to really start nourishing her body right out of the gates. And I think she even had bone broth with her in the car to start drinking. But she had already thought about this and what she was going to eat after surgery and planned for it. And she didn't have all that nausea and everything else to keep her from doing it. That's how quickly she wanted to get nourishment back into herself. And that's not unusual. Within a short period after surgery, patients are alert enough to eat, drink, and rest comfortably. That early nourishment, giving your body what it needs right away, that matters for healing. That starts the clock in a very positive direction. And the other thing that I think a lot of people don't always realize is even postoperative constipation, all these things can actually be significant problems for people because, if you're constipated, not only does it feel uncomfortable, but also I even had a patient who under IV sedation, she decided to take some pain medicines for an extended period of time after surgery, which most of our patients only take Tylenol, by the way, but she chose to take some. And as a result, she got constipated. And the straining involved, I think it was on day 5 or 6 after surgery, she got a little hematoma from that. Getting constipated after general anesthesia is a very common effect that can happen, especially for extended, longer surgeries. And this is, again, one of the advantages of local with IV sedation. Is it right for everyone? Now, I want to be very straightforward here. Most of my patients do extremely well with IV sedation, and it's my strong preference and it's my patient's reference. And since a lot of our patients, come from referrals and have been part of our social media and see lots of before and afters and journeys, etc., they're well aware of what they're getting themselves into and they're excited about it. They consider it a huge positive. But medicine is never a one-size-fits-all, and there are people with specific health histories, emotional histories, psychological histories that general anesthesia is actually a better and a safer choice for them individually. That conversation always happens. It always depends on the person. The goal is never to follow a rule. The goal is always to make the safest, most thoughtful decision for each patient. And for you as a prospective patient or somebody who might have surgery elsewhere, this is a conversation that you can certainly have with your surgeon. So if you're finding this information useful, please go ahead and subscribe. I break down real details of facial aging, surgery, skincare every single week. Things that are worth understanding, whether you're considering a procedure now or in the future. This is an important conversation for you to be a part of. So make sure you subscribe. So awake during surgery. It's not scary. It's actually one of the most patient-forward decisions I made in building my practice. Safer, more comfortable, and it puts you in a position to start healing faster from the moment it's over. Honestly, I sleep better personally at night knowing that patients don't have some of those untoward statistical risks associated with general anesthesia and the exposure to them. It really makes me feel much more comfortable, especially considering this is an elective surgery. People have families and we don't want to take unnecessary risk. And I perform these procedures very, very comfortably in that type of an environment, and it's a good way to go. So whether or not you're considering having this type of surgery now or in the future, this is definitely something, to file away and to have a discussion with your surgeon. It's an important conversation, and I think it's a very useful one. And you want to learn a little bit more about this, check out drkaram.com. And for those of you who haven't already, make sure you subscribe, but also make sure you subscribe to the Karam MD Journal, which is a newsletter that comes to your inbox every single week that gives all sorts of great information, and it's totally free, so you definitely don't want to miss out on that. If this has been useful for you, eye-opening for you, you have questions about it, drop them in the comments. Make sure you hit like if you enjoyed the video, and until next time, Dr. Amir Karam, thank you so much for watching.